I think in a Canadian context, as in other countries around the world, it's a journey to a digital future and the incorporation of virtual care. Some of the very first efforts related to actually administrative applications like insurance or billings, those kind of things. And then, there were some early adopters, some physicians and nurses and other practitioners who were keen, who either looked around for solutions that were available or in some cases built their own in the early days. And that's really how the journey first began. And then over time, obviously became much more central and just the regular part of the way many clinicians and provide care and many patients receive care. And that's an evolution that's happened over the course of a few decades. I think in a Canadian context, for the most part, digital health has not been politicized. There's been a general understanding about the importance of having a modern, connected health system and health care. And so many different parties from different parts of the political spectrum have supported different aspects of digital health over the years, maybe with different priorities in different cases. In some, for instance, a focus on telehealth solutions as a way to bridge care for people in rural regions. In other cases, it may have been other motivations. Which is not to say that there haven't been ups and downs over the course of that journey, but the sort of decision to use digital solutions in digital health has not been a particularly political one. It really has been something that's cut across many different perspectives. In a Canadian context, healthcare is primarily a provincial territorial responsibility, so in a federated federal health system, where the federal government has some roles with particular populations. So, for instance, the provision of health services for people in the military, particular populations. But in general, healthcare delivery is a provincial territorial responsibility. There were early on some efforts to bring together a common view across provinces and territories in terms of what was called a blueprint. So where were the priorities? Where were the common approaches that might happen? And some of that work was funded by the federal government. And indeed, the implementation was often cost shared by the provinces and territories and the federal government. So there was that connection, I guess, across. But each province and territory chose their path. So which areas would go first, which areas would go later, the ways that they would interact with clinicians, with citizens, with others involved in the process in their jurisdictions. So that indeed there were some variations across the country in terms of how that proceeded. So there are a number of dedicated organizations, both at the federal level, so Canada Health Infoway being an example there, but also at the provincial level. So a number of provinces have e-health agencies or digital health agencies, and the roles of those organizations are a bit different in different provinces. In some cases, they are delivery mechanisms, so they actually maintain and run information systems. In other cases, their roles are more around standards and interoperability and coordination. So the particular roles of those agencies do differ. In the case of Canada Health Infoway, it served very much in the first part of its life as a strategic investor. So coordinating some of those conversations across jurisdictions about relative priorities. But then also using federal government money from the federal government to match money from provinces and territories and others to support implementation of specific digital health solutions, and linking those funds to milestones in terms of the delivery of different projects. In addition, Infoway was also involved in things like clinical engagement, so engagement with groups like the educational institutions where curricula cuts across provincial territorial jurisdictions, and so an involvement at the level of physician, nursing, and pharmacy competencies for entry to practice was something that Infoway coordinated across jurisdictions as well. So it played a few different roles, as do the different provincial agencies as well. So, I mean, to some extent, success is in the eye of the beholder. So depending on who you are, you will appreciate more certain types of applications than others. One of the things that Infoway has done is done a series of consistent evaluations with a benefits evaluation framework that focused on benefits in terms of access, quality, and productivity. And you see a very different profile of those benefits across different types of digital health solutions. So in telehealth, for instance, which given our geography and the sparseness of our population was an early focus for Canada, you see primarily benefits accruing on access to care. Whereas another of the early areas for implementation was on digital diagnostic imaging. And there you tend to see high benefits on productivity, and some benefits on access as well. A completely different type of profile when we look at things like drug information systems, where a large proportion of the benefits accrued in terms of quality because of the ability to prevent drug-drug interactions and other types of quality issues. So it depends a little bit on which aspects, which dimensions you prioritize, and where you might sit in the health system. There is no question that trust is absolutely fundamental here as well. And that is true across the board. So from a citizen's perspective, it is an area where there has been a considerable focus over time, both understanding levels of trust. And so we have a very long tracking of individuals' perspective on trust, and also working with individuals to understand what would help to increase trust and how can we build some of those mechanisms in. Some of those are obviously very formal in terms of legislation or regulatory authorities, but some of them are less formal. They may be aspects of a system. They may be the way that you're introduced to access to your own records. Those kinds of things are also important. And so there were a series of efforts made, both on individual projects as they were implemented. So for instance, as personal health records were implemented, as patient portals were implemented, engaging groups of citizens in that process to understand what was important and how that could be achieved as part of the process. There were also national public awareness campaigns that occurred on both traditional and new media to introduce some of the concepts and introduce some of the approaches that were being taken. In addition, there have been active efforts to work with privacy commissioners. So all of the jurisdictions have formal privacy commissioners who are appointed by governments and have specific roles under legislation. So working with them as well on both individual initiatives, but also more cross-cutting initiatives. On the clinician side, some of the same approaches have been taken, and that trust is also important. That's trust not just, and the same would be true for citizens, not just in terms of privacy, but also in terms of the impact in clinical practice, the degree to which systems will affect work life, and efficiencies, and those kind of considerations. And so one of the things that has been a focus is around clinical engagement. And that has sometimes worked better than others. But the approach was really to look everything from engaging with leaders, so linking with leaders to understand their possibilities and their interests in this process. How can we understand what matters from their leadership role? to, at the opposite extreme, the next generation. So how can we build competencies into undergraduate education and undergraduate competencies in early training? Now, obviously, nobody these days needs to learn how to use a mouse, right? This is not the perspective, but it is around how, in an environment of telehealth, for example, do you establish an effective relationship with your patient? How do you change the way that you consent for a laboratory test if the patient will have access to that information digitally in terms of the results? How do you effectively ensure that the computer doesn't get in the way of your conversation with a patient in an examination room? So it's some of those kind of things as much as the sort of formal training on a computer system. It really is the clinical competencies to be an effective practitioner in a digitally enabled environment, not the how do you use a computer system. One of the things that I find interesting about lessons learned is that when we look internationally, basically we're all on the same path. We're just at slightly different stages and taking different routes to get there. And nobody in my experience is ahead in everything, and neither is anybody behind in everything. And so we all have things, and the same is true within Canada. Individual jurisdictions are ahead in one place. Maybe they've been much more active in the implementation of drug information systems, for instance. So one of our provinces implemented province-wide drug information systems more than 20 years ago now. Whereas others, have had a different set of progress and stages. I think we have seen the absolutely critical importance of both clinical and citizen engagement. And, sometimes we've done that better than others. And when it's done well, it is so important in terms of the realization of the benefits that we all want to see. Because that depends on understanding truly the context in which information systems will be used, and how do they just become the way we do things around here. So not something special that's done separately over there, but almost fading into the background as a tool that supports the way that you want to provide the best possible care, and the way that we as citizens want to be part of that care process, so that it really does become a connected care environment, not a digital solution on the desk.